JKLIVE here at Citizen Television. Talk about the ongoing strike. 3 unions at the same time. People are asking the question, is Kenya's healthcare sector in the ICU? On the far end, Peterson Wachira, he represents KUKO. That's a clinical officers union. Right in the middle, Dr. Davji Atela, he represents Kenya Medical Doctors and Dentists Practitioners Union, KMPDU. And right next to me is Pius Nyakundi, he represents the Lab Workers Union, or NAMLO. A lot of abbreviations. Let's see what happens going forward. Peterson, I wanted to ask you in the beginning, but I'll ask you right now. What does a clinical officer do? What's the qualifications?
Thank you. Clinical officers, let me say that clinical officers have been treating Kenyans since 1928. That is the first time a clinical officer was trained in this country. So we are primary clinicians. Primary clinicians means when you come to that hospital, we will be the first clinicians to see you, to diagnose you, and to make a decision as to whether you need probably higher, probably to refer you to a consultant or to inpatient. And we are trained at several levels, the lowest being the diploma. Then we have a degree, and we can go all the way to PhD. We actually have a complete career path. So we also have many specialties. And I must say that in this country, 98% of Kenyans coming to hospitals, we actually the people who treat them. And then we make the decision whether you need to be admitted, where a doctor will now take over as the secondary clinician. We are also the ones that actually create the work for the lab, because we are the ones to then give the instructions through the lab requests, the pharmacy prescriptions. And so we are the job creators, together with the doctors, of course, in the hospitals. So we have many specialties. When you go to theater, the anesthetists, 98% are clinical officers. The cataract surgeons, the ophthalmologists and cataract surgeons, the ones who are restoring sight to the blind because of the cataracts, we have around 97, 98% are clinical officers. The TB HIV clinics, we are actually the people who are running them. So basically, we are primary clinicians. Our role in this country is that about 98% of Kenyans who are coming daily to the hospitals, they go through a clinical officer. We are basically the face of the health system. And we work collaboratively. We complement each other with all the health workers, including the doctors and the nurses. And that is basically, in brief, what I can say about clinical officers. Of course, there is much more into detail of who we are.
Okay. Pius Nyakundi, what about you, a lab officer? And what does it take, and how many years studying and do they have to complete?
First, Jeff, I'd like to highlight on the training. We have certificate holders who are called medical laboratory technicians. We are diploma holders who take 3 years. For the certificate, is 2 years. The diploma holders are called medical laboratory technologists. We have the degree holders who are bachelors, who have done bachelors in medical laboratory science. They take 4 years. And then now we also have those who have done specialization. We have a medical laboratory hematologist who have done masters or HND. We have those that have specialized in clinical chemistry, histopathology, and many other. Now, what we do, Jeff, we are the people who do diagnosis of all the diseases. We do medical examination. We do medical tests right from malaria. We analyze all medical samples, that is stool, sputum, urine. We also analyze sputum for TB. And also, we also aid in treatment because we also do culture and sensitivity. For example, maybe you've been treated of a disease, and the drug that we are using, maybe they are not effective. We go to the lab and do what we call culture and sensitivity. And another thing that the laboratory does is the blood transfusion. We are the one who recruit donors. We screen that blood to know whether it has any pathogens or diseases for them to be transfused to patients. So that is the scope of the lab summary.
Dr. Atala, real quick, the head of public service, chief of staff, Dr. Felix Koskei, he said yesterday that as of tomorrow, the 4th of April, interns can pick up their letters for deployment. That's what he said, he stated. So, why still continue with the strike? Because one of the grievances was interns must be deployed.
Jeff, it's not just an issue of picking up the letters. It's an issue of proper remuneration as per the collective bargaining agreement. And I must say that if the government violates this particular collective bargaining agreement on part of interns, on what was signed, then there's nobody who is safe, because this collective bargaining agreement covers all the doctors in the universities, in the national referral hospitals, in the counties. And therefore, it's not just about picking letters. You can't pick a letter that is sending you to frustration, that is sending you to disillusionment, that has reduced your salary without consideration by 91%. We have directly told these particular interns they should not pick those letters. They have to wait until this thing is sorted out. And this is a violation that if left like that, then nobody is safe. So they need to provide those letters as per collective bargaining agreement that was signed. Because this intern doctors actually offers about 30% of services in the counties. And I must say, I saw the Director General yesterday saying these intern doctors are students. I also saw one of the former SGs, Dr. Martin Chero, saying they're students. So there's a problem here. The technical persons have become politicians, and therefore they lie in public, yet they went through the same process. I also saw the chair of the health committee saying the same thing. We have CAP 253 that explains what intern is. We have the PSC guideline on the same. We have the entry point. So you see these, and then also we have a CB that covers them. So this issue of just unilaterally deciding to change the terms and then say, go pick those letters, is wrong. We can't allow that.
Tell me something. You talked about salary arrears since 2017.
Yes.
How much is the average doctor owed from 2017 to now?
Ideally, the government owes the doctors about 3 billion, which means each doctor is about 1 million, between 600,000 to 1 million, accrued from 2017. So there's no way the government will say that they do not have budget for this, yet we've been discussing it every time. It must be treated the same way we are treating the pending bills. It must be treated like a Eurobond, which the government has been prioritizing to pay. So we cannot say that now, because you owe us, we can go back to work and wait for you to pay. We have had that before. So this CBA has to be implemented, and the arrears must be paid to each and every doctor across the country, because it was agreed, and we have a court judgment that actually enforces it, which government has been in contempt for more than 600 days.
Yes. Tell me something, Peterson. Health is a devolved element, right? Yep. It's all devolved. We've agreed with that. And each employer has a contract with the employee. How does this work in 47 counties, or make that 48 with the national government? How is that supposed to work?
It can actually work, and as you have said, health is a shared function. Yeah. It is devolved, yes, but it's a shared function. The policy, the training, capacity building are functions that are still with the national government. And that basically means that the leadership, the direction that we are supposed to take in terms of health provision in this country is a function of the national government. But then, with this government, we are saying that we're implementing the plan which was a manifesto of the current administration. We met the current administration and we made some agreements. One of the agreements was that we were going to take measures to ensure that we harmonize the way in which we do our collective bargaining. And when the summit sat in February of 2023, then there was a resolution, and the SRC was actually tasked to go and evaluate the health workers with a view to conclusion of collective bargaining agreements. When we then met in Kericho, in the Kericho Declaration of the last Madaraka, which was CHRIST and universal health coverage, in the Kericho Declaration, further to the two, from number 1 in the plan, then we came to the summit. And the third, we agreed that we were going to bring together the employers. We would find a mechanism, because it was a joint agreement, where all these now 48 can come together, and that is provided for in the Labor Relations Act as an association of employers, and then we can be able to negotiate centrally. Because there are laws in this country that provide that you cannot have 2 workers who have the same qualifications, doing the same work, under the same environment, and you pay them differently. Of course, we know that they are contravening the law, because we are having a number of workers who are being paid different pay, actually doing the same thing. But that is something we agreed, and I believe that that is actually the direction that we should be able to take, that all the counties should actually come together as employers and form an employers association, which can be under the Council of Governors if they have goodwill. That is what they should do. And we have presidents. Like ourselves, our recognition agreement was negotiated centrally. They sat at the 47 counties, they gave a team that negotiated on their behalf, and then we signed with each and every county. And the same should happen. That is what happened to the doctor CBA. That is what we were doing under our CBA. Before then, it failed, and then they refused to come back to the table. But even the court, the direction of the court was for them to bring that united team to negotiate on behalf of the 47 county governments.
Yes. Dr. Teller, do you agree, or are we looking at 48 different CBAs?
Jeff, the government play a lot of games, and the government most of the time enjoys when Kenyans are suffering. There's no way that we have a central treasury, we have one Ministry of Health, and then when it comes to the issues of primary health care, which the Constitution talks about it being a devolved function, we see the Ministry of Health receiving funds from donors. We see them handling it. When it comes to services in the counties where we have shortage of health workforce, they say health is devolved. When you go on strike, they say go negotiate with 48 counties. Yet we have salary delays every month in the counties, and counties are pointing at the treasury. They say they have delayed reimbursements. So health is devolved when government feel like doctors are on strike, so it's devolved. But then the times that the activities like UHC, they say the health is part of national. So the government speaks in 2 ways. You cannot say you're going to have UHC without a plan for human resource. We have said now and again that the government, actually, the program of UHC is a pipe dream. And it is clearly manifested that now all health sector unions are going on this strike. They're not going on this strike because they're enjoying strikes. They're going on strike because doctors and healthcare workers are suffering. And they're suffering to the point that they cannot afford the healthcare that they actually provide. We have doctors in this country who do not have comprehensive medical cover. Almost 80% of the counties. Doctors in the national government now don't have comprehensive medical cover. And when we asked, when the shift was being brought, they said, go back to your employer and ask for comprehensive cover. Now we are with our employer to ask for that comprehensive cover. And what does that mean? It means that if a doctor falls sick now, we have to go to WhatsApp groups and contribute. It means that if a doctor is admitted, you need to go abroad for a particular treatment, because we've had these cases. You have doctors who had cancers, where we have to contribute up to the last minute for them to go get this particular treatment. We have situations whereby a doctor is working in a hospital, whereby he has a child who needs care. He has to transfer the baby to a nuclear different facility because he can't afford where he works. So those are the reasons why this particular strike, we have said that we have had enough as doctors, to the point that we have nothing more to lose but the chains. Why we are saying that is because government comes with threats when doctors are on strike. But at this point, we have nothing else to lose. We have doctors, Jeff, who work in Kenyatta National Referral Hospital. They work in Moi Teaching Referral Hospital. They work in KUTRH. They work in Nakuru County. They're doing the postgraduates. And when they're doing these, they see patients who actually pay for the facility, pay for the services. But these doctors are earning zero, to the point that they have to go moonlight in private facilities to actually pay the fee and be able to pay for their, to cater for their bills. Yet this hospital exists, yet they work in these particular facilities. We have almost 1,000 doctors in the country like that. We can't say things are okay when this exploitation continues. We have situations in KNH where a doctor is paid full salary. Another doctor is paid a fifth of the same salary. So those are the things that we say, this is enough. we have to come out and correct it. And KMPDU is a member-driven organization. That means we leaders cannot say, go on strike, and then you go on strike. Members must feel the pain. They must feel the frustration. They must feel that there's no any other way that the government is going to listen unless we take out and go out on strike. That's why all our strikes have been having particular names. In 2011, we call it Linda Afya 1 because we wanted healthcare to work. 2013, Linda Afya 2. 2017, we realized that we are the least paid workers in this country. I say, Lipa Kamatenda. This time we are saying, yes, we have had a CBA. Yes, part of it has been implemented, but we want a full implementation so that we can enjoy the fruits of this particular collective bargaining agreement. And therefore, we have nothing more to lose by the chains. And that's why the strike may go as long as the government is ready to sit and negotiate. Whether it takes 200 days or 300 days or 2 years or so, we are ready for that.
They're ready to go 2 years if it takes that.
We are ready to go more than that, Jeff. Because it is the frustration, it is the pain, it is the convictions of the doctors from medical school to the consultants who are feeling the pinch of these particular things the government is doing.
And yet, Pius, the biggest losers in all of this is us. It's the ordinary Monanchi who cannot get services, who will not get any lab services, who will not get any clinical officer to look after them, and of course, no medical doctor. Kenyans are the biggest losers.
Jeff, it's unfortunate that the country is in this situation. Because, one, if I refer you to the Kericho Declaration, a meeting that was highly publicized, we had signed a memorandum on how we are supposed to tackle these issues. We had a timeline in every aspect. That meeting was attended by the CS herself, the 2 PS, the head of public service, and the Minister for Public Service, that's Moses Kuria. I can tell you to date, there is no goodwill. Nothing has been, so far, been achieved. No. And now we're wondering why we did a lot of PR on the Kericho Declaration on universal health coverage, when at the end of the day, the ministry is not committed to achieve anything. We will be seeing patients suffering because of the government. There is a reluctance to commit itself in improving or even attaining any of them. As the laboratory officers, it's unfortunate, Chef, that coming on Friday, we'll be withdrawing all the emergency services. That is the blood transfusion. Actually, there is a blood drive that was supposed to be done on Friday. We have already told our officers to cease because the government is not listening to us.
So what happens now if a patient urgently needs blood?
There's nothing we can do. Our hands are tied. To date, we issued a strike notice on 26th of March. My brothers are lucky they have been called for a meeting, even though they have not agreed. But because of the injustices, historical injustices to the lab, the ministry is taking us rounds. They have ignored us. What can we do?
Peterson, you were saying something.
Yeah, and Jeffrey, if I can just chip in on what you have asked. You know, it's interesting that as the unions, I think we are the ones with the interest of Kenyans at heart. And the reason I'm saying this is because in 2022, we actually sat together and we formed a caucus, which did not exist before. And we asked ourselves, what is it that we are doing wrong? Why is it that the health sector, it seems like the government is at war with the health workers, and it's only actually the health workers who do not have a CBA right now. It's only the health sector. And so we said, can we bring everybody under one roof, everybody who is concerned with health, from the CS to the private partners to the NGOs, and we came up with a convention. We called it the Kenya Health Workers Convention. We all came in from the Council of Governors to the Ministry of Health to the Ministry of Labor. Actually, the resolutions were read by the Cabinet Secretary for Labor then, CS Chelugui. And one of the resolutions, because when we sat, we realized that there were many things that in the room we could actually not understand. Nobody could actually put a finger as to why some things were not happening in view of very nice policies and laws that were providing for the same. And so we made a resolution. One of the resolutions out of the many resolutions was that we should have a presidential level task force that would evaluate, would analyze and look at the health sector and then give recommendations that will give us long-term solutions. So we did that, and we actually had a very nice document that we actually presented to the president, His Excellency William Samoei Ruto, when he was campaigning in a Catholic university. And it actually informed part of the plan. So when then he came into power, and we realized that it was not happening. We saw a presidential task force on security. We saw a presidential task force on education, but nothing was forthcoming on the side of health. So we actually sat together as the caucus and wrote, just to remind him that this is something that we had agreed on, but then this was not actualized. I think...
what was the response?
The response was that it was taken down to the CS. I tried following with the CS, but then nothing happened actually after that. And my opinion is that this is actually the problem that we do have, that subsequent governments have not looked at health as a priority. They have not looked at health as that central pillar, where actually economic and social development must rotate around. And that is the problem that we are having. Yeah. And if we are going to get solutions, because we have been saying that probably a Health Service Commission is what is going to work. The governors have been opposing that vehemently. But because of that, we said, why don't we have senior experienced experts who can sit in a task force? Then we can come there and say, we think a Health Service Commission is the answer because of 1, 2, 3. The governors can say, no, we think we have another solution. And then they can come up and tell us there are these legal, there are these constitutional solutions that we can be able to provide so that going forward, we can be able to offer Kenyans uninterrupted health services. Yeah. But that is not happening because it seems that there is no goodwill.
Dr. Davji, tell me something. If Health CS Susan Nakhumicha was watching now, let's say she's watching you guys right now, what would you tell her?
That's just to take responsibility of healthcare and actually act in the confines of the law. It is actually it is immoral, actually, it's an injustice to be in a docket and decide to disregard all the regulations in that particular docket and then let it be. We are here today on this strike not because doctors want to go on strike. It is because the government has fueled the strike. Because number one, the way they speak about the issues that we are putting forth is totally disregard the requirements. They decide to not to pay fees for postgraduate doctors who then are doing their masters. These doctors are bonded to actually go back and work in the counties. When the fees are not paid, it means that you have to take 2 more years before you go to the counties. We had promises with her, which we signed an agreement in January 2023. That was not implemented. We have the issue of interns that was to be easy and regularized. They have already violated CB on that. We have basically areas that is owed to the doctors across the whole country. That's why I keep saying that there's no governor who has moral authority to actually intimidate any doctors unless they pay all those basic salary in arrears. And this has not been sorted out. We have the issue of the comprehensive cover for doctors and civil servants that was brought about by the Social Health Insurance Act, again by the government. So ideally, she must actually come out with resolutions, not promises, over this issue that we have put forth. Because one thing that we know, they keep saying goodwill, they keep hawking goodwill to us. But you know that goodwill comes out of consistent promises that are kept. We have given them time over these issues that have never implemented them. The other thing that is very critical that Kenyans must see now, ask yourself, the MCA that you elected in that county, what does it feel when the hospitals are closed and the doctors are out? The members of parliament, and I must thank the members of parliament that I saw today supporting the union, Honorable Babu, Wamuchomba, and Oledema, because they have realized that their constituents, they have a moral responsibility to ensure that right things are done. And also they say, and also the governors who are quiet. The reality is that this particular strike, if it continues, it is the government that takes full responsibility because they're the ones who have resources. They just have misplaced priorities. They want to spend these funds on a different thing other than ensuring that healthcare works. Jeff, now as a country, we are at a point whereby the WHO recommendation of a facility per population, we have surpassed. the WHO recommendation. But as a country, that means every governor is building a lot of facilities. The white elephant projects across the country, both national governments and county governments. But in terms of health workforce, for example, for doctors, we are at 1 to 17,000. It means that it will take the country 50 years to actually have the number of doctors that will be that will serve as per WHO ratio. Yet we have unemployed doctors. So ideally, government must walk the talk. They might not just give rhetorics, putting policies, the acts, and all these talks and launching everything every day without a plan to have Kenyans access healthcare. It is their responsibility.
Absolutely. Piers Nyakundi, it looks like the nurses union is not going to be joining this strike. They say that they're having cordial talks with the government. Why can't you all have cordial talks?
Jeff, I could not be in position to speak on behalf of the nurses union, because they have their own way of doing things. I'm Secretary General for the Kenya National Union of Medical Laboratory Officers. We have tried as a union to solve this issue amicably without going for any industrial dispute as we are in currently. One, even before this strike notice, I've indicated that we have tried to even request for a consultative meeting over these issues, because a recognition agreement does not need any budgetary allocation. It needs a paper and a pen and a goodwill. We have tried to do that. They have failed.
They haven't talked to you?
Yeah. They have not. As we are speaking today, we are on strike. We issued a strike notice. Nobody has ever called us. We are not in any discussion. So in short,
it's lucky if he's not called for meeting, because some of those meetings are just academic exercises.
So what I'm saying, as for the lab union, is sometimes it's also good to disagree in a meeting, agree to disagree or agree. But as things stand now, our members feel that we are being treated as third-class healthcare workers. So without them, and that is why we want to show the ministry. Actually, it's unfortunate that the Kenyans will feel the weight of this strike come on Friday, when we withdraw all the services from the HIV support centers, where we do the HIV testing, we do the CD4, we do the sputum follow-ups, and the blood donation and blood transfusion and blood screening. That one will stop.
You're going to bring healthcare to a standstill?
Yeah, because the government has gone on strike. But the CS is forcing us to be on strike.
Dr. Davji.
Ideally, we don't enjoy being on strikes. And,
but you're in day 21 now.
We don't see the success of strikes based on the mortalities that occur in the country. I mean, a successful strike should be shot with an effectiveness and result. We had a strike in 2011 that went only for 10 days, but then the issues were resorted. It means the government of the day were interested in the plight of the Kenyans. But now we have been forced to be out. It's not that the doctors wanted to be out. They've been forced by circumstances. And many times, I see many people say that being a doctor is a calling, so that you are called to be in the facility. But the reality is that anybody who is in the facility, you should just be there to certify deaths, because that also has been happening. We have seen cases where doctors are being reported for negligence to the Kenya Medical Practitioner Dentist Council. And the reality, when this was assessed, we realized that 80% of the cases of negligence is because the facility is dysfunctional. You get an emergency, you go to emergency, there are no drugs, there are no equipment. So your role is just to supervise death. And that's why doctors are on strike to make the public healthcare work. But the reaction of the ministry and of government to reduce the wages to 91%, it's just a backdoor privatization of healthcare. Because they will say healthcare is not functional. They will say that if we need to have efficiency, then we have to privatize it. Yeah. And I think the bigger forces to this, and that's why you realize that even though the strikes are continuing, they show very little interest to solve the issues.
Tell me something, Peterson. What will it take to have a functional health system, especially now the reforms are going from NHIF to SHIF? What will it take?
Thank you, Jeff. You see, to have an effective health system, there are 6 components. The financing is just one of it. So in financing, we have, I think, three sources of financing. We have the pooled financing, like the one we are going to have under SHIF. We have the out-of-pocket, and of course, we have the donors. So that is just going to mobilize money so that the other systems can work. Then, of course, we have the essential supplies. We are having a lot of issues with the supplies, especially of the essential medicines. We have the information and technology. We are talking about digitizing health so that now you can be able to access that data from anywhere, which is a very good thing. But then it relies on the financing. We have the human resource, and we have the infrastructure and the others. But all the other 5, they actually rotate around the human resource. So it must start with the human resource. Now, when you come to the human resource, an example of clinic officers, right now, according to the ministry itself, we need around 24,000 clinic officers in the public healthcare system. I think he talked about around 14,000, because he said an addition of 10,000 from what they have.
We need 50, but
you need 50.
The next 5 years, we need 10,000.
Yeah, the basic that the ministry itself has actually projected.
And how many clinical officers are there right now?
We have 6,900. We have a shortage of 17,000 to just have the basic services run, so that we can be able to implement the universal health coverage. And in the plan, I keep referring back to the plan because that is where the guideline to this government. We say that we want to move from universal health coverage to universal health care. And what that means is that we are not only concerned whether you are going to access that service in Mogotio, we also want to know the quality of the service that you're accessing. And that quality must come with adequate staffing of the right skill mix. And that means that when I go to that facility, if I needed a service of a gynecologist, if I needed the service of a reproductive health specialist or a cardiologist, if I don't find that specialty in that facility, then I cannot access that service. It also means that if I'm going to that facility, but I'm going to wait from 8 a.m. until 4 p.m., like many of our patients do, then I don't have access, even if it is next to my farm. And that is what is happening to Kenyans. And there are many who have suffered. I like giving this example, Jeff, because Kenyans sometimes do not understand what we are saying when we talk about shortage and how it affects them. A simple thing that we know of, like pharyngitis, tunasema umegonjeka koo. It is very simple to any Kenyan. But imagine of that girl who gets that infection and it's not treated in time because of the shortage of health workers. Then they develop another disease we call rheumatic fever and affects their heart. They get a heart lesion. But most of the time, you're not going to know it at that point. When they become adults and they become pregnant, some of them die from that heart disease in pregnancy. But that heart disease could have been prevented when they were a small child, when they were a small girl. If you had the right skill mix of the health professionals with adequate staffing at that point. But a Kenyan will not know of this. I know because I have been trained. And that is why we say we are advocates of the patients. And when Kenyans see us out there fighting, they should actually join us. Because at times, we have seen Kenyans try to fight us. They think we are actually the problem.
Yeah.
But actually, it's only that what we understand and what they may not know because they do not have the information that we do is what actually makes us go out there and fight so that we can save that one life that probably we are going to lose 20 years to come because we failed at this moment. Yes.
Doctor.
I was just trying to think regarding this healthcare currently. We have seen church leaders coming out to call for resignation of particular ministers. And this is not political. It is geared on what they see in the facilities, what they see in the hospitals. So there's an aspect that the people that have been entrusted with this particular work don't care. They don't care about facts. They don't care about the service provision. And that's why it's high time that Kenyans look into it, that how can they be part of the healthcare that they need? Because when we're advocating as unions, we are not advocating for ourselves. Yes, strongly we want the healthcare to work. When we come from, because we spend all the times in the hospitals. So when we come out and tell you that the hospital is dysfunctional, because most of the time people visit this hospital on a crucial need, and then they lack those particular services. That's when they come to know. We saw it yesterday when there was a case of accidents in Embu. The politician was airlifted to Nairobi What about the Kenyan who is there? How can I get the care? So ideally, we need to make it possible for these particular political leaders to understand the accountability and the reason why this hospital need to function. And this can only be done by Kenyans when they come out strongly to make every member of parliament, to make sure that every governor actually take issue of healthcare seriously. And that is not just by talks, because you've seen a lot of rhetorics by different leaders, even by the UHC thing, but it does not translate to the budget of healthcare. We see the budget of 9% to counties. We see the budget of about 140 billion to the ministry. The overall healthcare budget is 6%, and that's why there are problems. So we must invest in healthcare. And the WHO DG was, the Director General was saying, a time has come that countries must look at healthcare as an investment, not just recurrent expenditure, because that's why the counties cannot employ. And by the time they don't employ because they claim ballooning wage bill, yet we see the budget always rising, it becomes a problem.
Gentlemen, I'm going to go to the magic wall and get the reactions, because a lot of our viewers have been sending in their reactions. Let's see what they have to say on the magic wall. I hear a lot of tweets are coming in very thick and very fast. Let's go with Okello James 3 says, the deafening silence of the president over the impasse between doctors and the Ministry of Health is life-threatening. Wanjiku is feeling betrayed and neglected. I believe the president's intervention is what it takes to unlock the impasse expediently. Health is wealth. What do you think, Dr. Davji? The silence of the president in this?
Yeah, it's quite worrying. That's why yesterday we called it, we say that a point has reached whereby the minister and the cabinet secretary has shown that she cannot actually resolve the issue. We've had meetings with the head of public service, and the issue has been resolved. So a time comes when the person that has been elected in office, in the top office, of which these people have been appointed, when they fail, the person who takes responsibility is the head of state. And that's why we believe that he has to get down and look into these issues and resolve it. Because the Kenyans who voted, we are Kenyans, doctors and members of the public alike. And therefore, when we say that there are issues, if it is the issue of budget, he can resolve them.
Pius, do you agree?
Jeff, what I can say is that today we've had the clergy raise their issues over the current stalemate. We've had politicians. I think it's high time the head of state to take responsibility, because the people that entrusted with the ministry docket, they have really failed the Kenyans. It's high time that he brings order in the ministry, because Kenyans are looking at him. And we expect him to say something, because his silence is also hurting the Kenyans.
Washira, I see you nodding.
Yes. You know, I was surprised that actually he went out of the country at a time when Kenyans are dying, when you're having a health crisis. And you know the buck stops with him. The people we are talking about are his appointees. And he has the power. He has the tools to manage whatever we are having before us. But then I think I also agree with him that I'm also concerned about his silence, because by this time we expected that he would have come out and probably given direction, because that is what he's supposed to do, as to what we are supposed to do so that we can resolve this.
Yeah, absolutely. More tweets, thick and fast. Nzioki Mutuku says, somehow persuaded to believe that this strike has been motivated by the changes at NHIF that will deny private clinics owned by these same doctors an opportunity to financially exploit NHIF or SHIF.
I think that is actually far-fetched, because when we look at our talks on the SHIF, what we were advocating for, we want SHIF to cover all Kenyans comprehensively. That if you go to the hospital, whether it is a public hospital or private hospital, you get care. You don't have to go through what you call co-payment, where you go to an hospital and the hospital covers a particular percentage of your care. So that means we wanted every Kenyan to have an enhanced coverage. But what was there in SHIF that we were opposing was that you will have a SHIF, you pay 2.75%, but then you are being told to go talk to your employer to get another private cover, yet you're paying almost over 100,000, 200,000 per year. So in essence, we are actually advocating for every Kenyan to be able to access this care without any extra out-of-pocket expenditure.
Yes. Okay.
Yeah, and Jeff, if I may add, actually, I think he doesn't get it. Because actually SHIF is going to favor private sector. And this is how it's going to favor private sector. With SHIF, the patient will have the power to decide where to get the service, faith-based, private, or public. And where do you think Kenyans are going to go to? Of course, the private, because they are better. And so most of the money from the SHIF is actually going to go to the private. Even NHIF was better. It was a bit more balanced. Yeah.
Okay. Next, Angololo Oramisi says, please ask the gentleman how much percentage-wise of the 7-year previous CBA the health workers had with the government has been fulfilled by the government so far. I'm curious to know how deep these waters go. I think you talked about the money owed to the doctors right in the last 7 years.
It's money and also other parts of this particular CBA.
Yeah.
We are not only complaining about non-implementation of the CBA, but we are also concerned in its violation. The CBA has not been implemented because the basic salary have not been paid. There are other components of it that will make healthcare functional, like they need to have drugs in the facilities, they need to have more doctors employed, they need to have the functionality in the hospital. Those have not been implemented. So averagely, about 90% of this collective bargaining agreement has not been implemented, but the government has taken an initiative to now violate it and manipulate it.
90%?
Yes.
Has not been
implemented.
Eric Monene 254 says, amidst medic strike, it is crucial to seek constructive solutions. How can stakeholders collaborate to address grievances and ensure quality healthcare for all? Do you think resignation/impeachment will solve this problem? Pius, resignation, will it solve anything?
I think to me, it might not solve everything because we have had some issues which are very perennial that needs to be addressed in a manner that does not necessarily force the CS to resign. Though as of now, she has failed the Kenyans, and her resignation to some extent can help, but that one does not solve the problem entirely.
You agree, gentlemen? It wouldn't solve it entirely.
Yeah, I think what I can also add is that the solution was given by the Labour Court in the case of KMPDU versus the government. And the judge said that we should actually have a whole of government approach, which basically means national dialogue on health. But the misinterpretation by the government side, because we have seen them now go back to national government and county governments, and they're addressing from their different sides. But I think what the judgment is that we need national dialogue on these issues so that going forward then we'll have long-lasting solutions.
Yeah.
But I don't think dialogues help these things.
Talk is cheap.
We've had so many policies and so many acts and laws that have been made, but there's no implementation. I think that...
What you're saying, you're sick and tired of the talking.
I mean, we have had talks. Last year alone, we had over 30 talks with the government over these issues. For us to go on strike, it means that it just talks, there are no plans to implement them. And ideally, what I'm saying is that we have to see goodwill from the minister. The cabinet secretary need to advise the treasury, support the budget, need to advise the counties, need to advise the president on these issues. So when things are falling apart, she should not be part of actually creating more crises. It should be part of resolving it. But the utterances that we have seen for the last 3 or 4 weeks of how doctors will be fired, how they will change the laws to change these things, how some utterances also in rallies and in funerals actually aggravates more. So ideally, if she can measure what she says and look facts into them, have benefit of actually solving this. But what we have seen are the opposite. Even this aspect of reducing the salaries, nobody has ever tried this. I mean, that is calling for a strike by herself.
Yeah. Okay. Alchemist Kenya says, I think the government, with a budget heading to 4.4 trillion shillings, cannot be broke to afford 10.2 or 100, 10, 20 or 100 billion shillings for doctors. It is ill will and misplaced priorities. We happen to see this. You agree?
100%. It is a misplaced priority. And yeah. I mean, if they have done all the things in healthcare except the human resource functionality, that we don't care.
Excellent. Yeah. Seth from Kisii says, the medical doctors are using their critical profession to arm twist the government. Secondly, I strongly believe they are being used by opposition machineries to catalyze the issue to bring down the Kenya Kwanzaa leadership. Let them accept the remuneration they have. It is among the best within African countries. Washira, say your arm twisting.
Yeah, you see, one man called Paul Clark said that for a worker, the only tool they have that they can negotiate with is their skill. And it's only through the withdrawal of that skill that they can get their employer to actually come to the table and negotiate. And it actually says that strikes are not against the collective bargaining, but actually they are the cornerstone of collective bargaining. And that is what we are trying to do. And we have demonstrated that we have taken enough measures so that we couldn't actually go on strike. So we are not twisting anybody. It is themselves who have actually pushed us to this. They have made it a necessity.
Yes, Jeff, salary is a compensation for work done. It is not a present. And as unions, we come from different political dynamics and from different setups. At no given point, we will try to be convinced maybe by the opposition or the government. We have our own salary, the politicians have their own salary. You cannot compare the salary of a medical laboratory officer to even a PA, a personal assistant of an MP. So completely this thing is out of politics and we don't want to take that direction.
Doctor?
Jeff, doctors are like a tribe in themselves in this country because of the union. And therefore, when an intern doctor's salary has been reduced by 91%. It doesn't matter where you come from. It doesn't matter the political affiliations. It is the issue that has been raised. When the collective bargaining agreement has not been honored, it has not been honored for all doctors across the country. And that's why when doctors come out to cry and to force things to happen, it's out of conviction, regardless of political affiliation. And at this point, we do not care whether civil societies, whether particular members of parliament, whether senators come out to support us, because what is vital is the resolutions. And these political leaders, regardless of their affiliations, they have representatives that must get health care and they must do their duties, regardless.
Okay, a couple of comments here. Confraternity of Patients of Kenya, that's COFPAC, says the ongoing industrial action reveals the vulnerability of the average citizen and jeopardizes our ability to achieve universal health coverage. It is crucial that a solution is promptly found to address these challenges. Armstrong Alaro says, why should the government only take action when there is a crisis? Should demands, bargains and agreements be made through cessation of operations? This is now becoming a trend. We can do better. And finally, Sir Nixon Dugida says, I highly hope that the greatly concerned CS of health is alert all through this debate by health union intellectuals, where I'm sure she might gather strong, valid points to assist in the dialogue to end the strike. Mungu wasaidie wote. Wow. Strong words, strong opinions, strong reactions from Kenyans out there, especially thinking that it's going to get rough going forward. Let me get some final thoughts going forward. Pius, let me start with you. You say Friday, deadline, all tools down, no lab will operate.
Yeah, we are withdrawing all the emergency services from all the laboratories, from the national reference labs, from the county laboratory labs that are still operating like the national blood banks, because we have members working in those laboratories. They are members of our unions. They are entitled to the rights and the welfares that we are demanding for. What we are asking the government today, that is the ministry and the county governments, listen to these healthcare workers' unions. Respond to them. You can always agree to disagree, but there are some things that you cannot take for granted. Today we are sitting here discussing a recognition agreement that does not need a budgetary allocation. It needs a pen and a paper. 4 years down the line, the government has neglected us. We are telling them that we are not going to bow down anytime soon until they heed to our request. Yes.
Peterson Washira, moving forward, final thoughts.
Yeah, I think I want to talk to Kenyans, and I want to tell them pole. And I also want to tell them that your leaders are failing you, because you have a right under the Constitution, Article 43, to access healthcare services But your leaders who are supposed to be ensuring that you access that right are actually the ones hindering it by not coming to the table. But also, as a good citizen, you also have a responsibility to take that leader of yours to account. So please, if you are a Kenyan who is suffering, go to your governor, go to your MCA, go to your senator, and please ask them to tell the governors to stop striking. Because in our case, there is a court order calling them to the table and they have refused. Please tell them to come to the table so that you can access that service, because you are the person who chose them. You are the person who gave them that power that they are now utilizing to frustrate the unions. And by extension, to hinder that service that you are supposed to access as a right under the Constitution.
Dr. Davji, you get the final word.
Yeah, Jeff, I would say that this issue of healthcare and the rights of doctors and the rights of functional healthcare system, public healthcare, is something that we are convinced to fight for. And as a union and as a union leader, it's something I'm ready to die for. And I know that the doctors are convinced and they know very well that the issue that we raised in our strike notice is going to cover every doctor in the country, from the interns to the consultants, with an aspect that the public will get the health care. And therefore, the simple thing, and this is something everybody has been asking, what are our bare minimums, is that the CBA needs to be implemented. The interns need to be posted as per the collective bargaining agreement that we agreed. The doctors need to be employed. And we must leave the table when the numbers that are being employed are indicated for the next 5 years for posterity. We must look into the issues of healthcare, the issue of postgraduates, those who are slaving in the hospitals, they must be sorted out. The doctors must have a comprehensive cover. So we must have functional hospitals in the country. That means there must be a budget that will make sure that the hospitals are well stocked. We had asked for about 45 billion to the counties. It may not be now, but in reality, we want functional hospitals where patients come and actually get treated. And therefore, now, as we are on this particular strike, we say we join the government. And we will be on it until the time they acknowledge that we have to sit down and have these issues resolved. It's not time for promises. We always listen to promises and take them when we are at work. The moment we go out on strike, we have jumped into the river with both legs. And as days go, we sink more deeper into this particular river. And therefore, that's how our expectation and result of the strike goes. And I've seen many leaders, many county leaders, Ministry of Health, National Referring Hospitals, giving doctors showcause letters, suspension letters. Some are even planning to dismiss them. I must say that the ILO Convention 29 indicates that we cannot have forced labor. We cannot perpetrate modern slavery. It is important doctors to work at will when they're in an environment that they can serve the patients. So therefore, no amount of these threats, this victimization, these intimidations that will make us change our resolve, it will be until they implement what we're demanding. They may fire all the doctors, they may shoot all of them, they may clobber all of them, but until these things are implemented, no one will go to work.
Dr. Davji Atela, representing KMPDU, Peterson Mashiro representing KUKO, and Pius Nyakundi representing NAMLO. Thank you so much, gentlemen, for your time. We wish you all the very best going forward. I guess the biggest loser here is us. Like I said before, it's Kenyans. It's going to be a tough, tough call going forward, because if the gentlemen, what they say is going to happen in the days going forward, well, tough times ahead for Kenyans. You can't afford to get sick. You get sick, you're going to die. That's the bottom line. Unless someone yields. Right now it's a standoff, an impasse, whatever you want to call it. But someone's got to give. Some side has to give. Which side will it be? Thanks so much for being a part of the show. You know, remember, if it's Wednesday, it's all about those 3 letters on the keyboard that follow each other. JKL. Thanks so much for